Hello YouTubers, it's Arya here. Welcome back to my channel. Today I'm going to be doing my makeup, getting ready here because I have to work on a paper and I don't have a lot of time on my hands, so I'm gonna try to make it work here. But I'm using my Lorac palette, and I'm gonna go in with these three colors: the green one, the gray one, and the black one. Kind of want to make it like a dark color because the dark kind of helps hide the swelling in my eyes, and that's always a good thing. So I'm gonna bring it down here a little bit. Oh yeah, you guys can see that. And you guys, I haven't talked about this yet because I've kind of been talking about other things, like the negative reaction that I had to my recent Nerf vlog 5 days ago. But now that I feel better and that's settled down, I feel ready to talk about this. So basically, at my last Nerf vlog, my doctor asked me about my anxiety and depression. And I don't know if I was giving off some vibes, you guys. I know that I've had some emotional problems with going under before. I know the first time that I had a block, he had mentioned that I was crying hysterically, and I actually don't remember that, but at the time that was a very hard time in my life, you guys. I mean, everything had changed once I was diagnosed, so that was not fun at all, as you can imagine. Now I'm gonna go in with the charcoal color here. Yeah, so anyways, he asked me about that, and you know, I've seen this doctor, you guys. I've seen him like 6 times now, I would say, and he hasn't really asked me about that before. So we were just talking about, like the sympathetic nervous system and how that if you start overreacting and getting wind up with like stress, anxiety, depression, it can make pain problems worse. So he was explaining that to me, but I was telling him about my leg. So this is a workers' comp doctor, and I know it's not work related, but I wanted to know what he thought about my leg, if he agreed that it was, CRPS, and he like pretty much said it's the beginning of it because of the hypersensitivity, but I have other symptoms, but there's not a lot of time to go over everything, so I just kept that to myself. But yeah, so then he started asking about like I'll just put A because I'm not alone right now, about my A, which is anxiety, and D is depression. So yeah, he started asking about A. He asked me if I'd had problems before with it, and I mean, I didn't really want to answer those questions because well, I mean, it's workers' comp, and I'm sure they um I'm sure they note it down, and then like your employer has access to those records. Well, I don't work there anymore, but your employer has access to your records, and like my lawyer sees those records and the other lawyers see those records, so it's not private at all, right? So I didn't really want to answer, so I just said, I mean, it was more like stress, stress. And then I remembered about, well, I had a flashback about my mom and, her cancer treatment at that moment. And I was just thinking, but anyways, he was just asking me about these problems. And then he was asking me about my A, but then I told him, you know, it's not really A. Like, I don't feel A. I feel more D. Yeah, because my heart rate usually gets like to be like 120 when I get in there. I know it's not, I know it's high, but I mean, I'm sure other patients get that way. I don't see why it's such a big deal, I guess. You know, I've had this for a while where I get high BP, high heart rate, and like, you know, why now? Why are you mentioning it to me now? Unless I've been waking up crying after every nerve block, and I've had two recently, very recently. In the last month, I've had two. And then in November, late November, I had a third one. So I guess I have had 3 recent ones. So I don't know if I've been, you know, crying afterwards still or what. But yeah, so he asked me about it, and then he was just asking me about questions about that, about my mental health. And then he started saying how a lot of people who are always on the go and winded up get like these kinds of neural okay, anyways, just backtrack. I think he was just trying to say that A and D have a lot to do with like your sympathetic nervous system, and that if you're constantly super overactive in your mind, that it can make things worse. But then he asked me a question about trauma. He seriously asked me, do you have any history with physical / emotional / sexual trauma? And well, I wasn't expecting that, and he kind of put it in there while he was asking me a series of questions. So my mind was on autopilot, right? And I mean, I paused and then I answered the question, but I mean, he was, so I understand what he was trying to say. You know, I do understand what he was trying to say, and I don't feel comfortable going into detail anymore other than that. So I don't know if I'm having bad reactions when I wake up from the procedures. I know that I'm claustrophobic sometimes, and they do restrain you because the injections go in my neck. So like this last time, they like strapped me down, like my legs and my arms, like a lot. Like I could barely breathe, and I was still awake for that. But anyways, I'm claustrophobic and I like being in control. So it could be a control thing because I am, you know, very like a control freak about everything. So anyways, he asked me those questions and I answered, but now after coming out of the procedure, I am nervous and worried about like, oh my god, you know, is my lawyer going to see that? Like, oh my god, is he going to put things in my record relating to my anxiety and D? And that's like, no. Like, I've always been so protective about that information, and workers' comp has, well, I was coerced to release my mental health records when they found out I was going to counseling. Never be trusting you guys. And yeah, like I had no choice but to sign a release of information, or else it could have jeopardized my case. And even my own lawyer, she wasn't on my side. She was like, oh yeah, it's very normal to release that, when in the very beginning she had said, well, they would need a court order. So anyways, they were just very coercive about my mental health records. So now I'm really regretting having disclosed all of that to my doctor, and I did seek out advice about it, and now I know that next time I'm probably going to just say something along the lines of, I'd rather not talk about it, or it's not work related, because because I mean, it's not necessary. I mean, I have issues, you know, you guys know that I have issues, but like having it be in my record where it's workers' comp and anyone can have access to those records. I mean, if I get injured again in the future, they're going to look back on these records. Like, it's like a paper trail. And I'm a very private person to begin with, so I made a mistake and now I'm regretting it and I can't take it back. But at the same time, like, I've seen that doctor before multiple times. He's never asked me about those things. I don't know if he was trying to build some trust rapport or anything, but now I feel like, well, I don't want to say a betrayal of trust. I just feel like he shouldn't have asked that, and not that it was coercive, but that I kind of fell into a trap. Well, not really a trap. I don't know. It's just hard because it's workers' comp, and you know, has been a good doctor, but I feel like he just kind of, I don't know, like, workers' comp doesn't need to know that, and I let my guard down, and so I'm kind of frustrated with myself about that. And I hope he never mentions it again, because that would be so freaking awkward. And like, there really wasn't much about a conversation about my mental health. You know, he wasn't like, well, we can get you connected to counseling, therapy, like, I could, like, nothing. So like, what was the point of even asking, you know? And oh yeah, guys, and no, I would not, like, I've been offered counseling before, and maybe he did see that. And like, I would not do it through workers' comp. Actually, I wouldn't even go to counseling because of that risk that they would be entitled to my record, pretty much. Yeah, I cannot have that happen. So that's just like another lesson that I learned, to not divulge any information that I don't want out there, because now I don't know how it's going to come back and haunt me, but I'm sure it will, because usually it always does. So yeah. And I mean, they don't really need to know. And you know what, you guys, when they increased the medication, I wonder if it was because of that, because of like the whole A and D talk, and like, I wonder if they thought, oh well, if we just give her more medicine, she'll be fine, she'll be better. But no, I like pretty much wasn't fine and I wasn't better. Okay, I'm like trying to do my makeup here, you guys. So anyways, this is like a dark makeup, and like, I always say like the secret to makeup is to blend, 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 but like, you guys, nothing wants to blend today. Nothing wants to blend today, but like, I think that like the darker makeup kind of hides the swelling a little bit better. Yeah. So anyways, let me know your thoughts, you guys. If you guys have ever divulged any information and you regretted it, you know, what did you guys do after? Was it okay? Did you feel weird about it? I mean, I don't know. I just think I went too far, and I also think that it wasn't necessary to ask. I mean, I guess I could understand there are doctors, but like, I don't know, it's really hard because they're not just doctors, they're workers' compensation doctors, and those doctors are usually like not on your side about anything. So I'm very worried about like, what if like this comes back to bite me in the ass somehow. It's not good. I just wasn't prepared. Anyways, I look like a biker now with this dark makeup, you guys. But I guess now I can go and get ready and work on my final paper and get things done. Oh my god, is that a bald spot? Oh my god, I'm losing hair. Okay. Anyways, you guys, thank you so much for watching. I will see you next time. And if you enjoyed this video, please like and subscribe to my channel. Bye, guys.